Hi, everybody. This is Scott McGann, and I'm your health agent. And today is April 3rd, and we're going to continue to do these COVID-19 updates on a weekly basis. Individual questions, you could always call the health department at 508-495-7485 with direct questions. We'll do our best to get back to you as quickly as we can. Also, the falmouthmass.us website is updated daily. So for specific informations and links to other websites, we're doing our best to put the best information out there. Kudos to someone who volunteered to translate some of that into Brazilian Portuguese, so there's some of that on there as well. And, we're doing our best to keep you guys informed. As of this week, we're in the 50s for caseload, number of cases that are positive for COVID-19. Those are test results that have come back from actual tests. Physicians may be diagnosing without tests. Those would not show up on this. The asymptomatic obviously do not show up on this as well. About 13% of all tests that are occurring at 4Cs, that's our testing center for the area at 4Cs, Cape Cod Community College, about 13% come positive. So if you got a doctor's note to be tested because you're having symptoms, it's coming out positive roughly around 13% of the time. Our 57 or so cases, and I'm going to update that hopefully by the end of the day, we're higher than any other Cape Town. We've got about a little over 20% of all cases in Barnstable County, so we've had the spike here in Falmouth. We're working hard to trace back, find commonalities, figure out what's going on as best we can with the information we have. If I want to make sure I mention this, if you are contacted by someone at the VNA or our department, and we're looking at doing quarantine or isolation if you were a case or if you were a contact, our interview is really critical. That's where we're going to get our information to go from there. And the less information we're given, the less we can act on. So it's important if you are asked to be put in quarantine, and if you're doing a follow-up or you're a case and doing a follow-up, the more information you give us, the better. It gives us a better way of determining what to do. So, like I said, we are on the high side for counts. We are working our tails off to figure out where and common areas and so forth. But I do want to say that social distancing is obviously going to have an impact. People might be really nervous about the count going up. I think that's to be expected. But to think if we didn't do social distance, what our counts would be. Right now, let's say we're at 57. We're not catching everybody. So let's say if our count was 2 or 3 times higher than that, then if we didn't do the social distancing, it could be 10 or more times higher than that. COVID-19 spreads quite easily, and they're finding that it's a much easier spread than, say, the flu, and obviously they're finding that out and changing guidelines as we go. So I want everybody to make sure that they stay the course with social distancing. Right now, May 7th is sort of the magic date, and that may or may not change. Also, if you've listened to the governor's speeches, press releases, they're thinking the end midweek next week to the following week or so is going to be the peak. In speaking with the hospital is busy. The hospital is working on things like surge capacity in other locations. They're okay, and they're working on getting more PPE. They're doing an excellent job of getting ready for this surge, that we're expecting over the next week to 10 days. But in getting back to social distancing, it's really important that you're not that person. Don't, stay at home, call your doctor if you have any flu-like symptoms. Don't be a hero and try to go out and try to do the work. I think everybody will accept the fact if someone calls in sick. And then, because part of it is people going to work thinking they can squeeze an extra day and they really weren't feeling well. And that's kind of the more common way that the common colds spread every year, the way that the flu is spread every year. And we just don't be that guy. And so we want to make sure that people are very aware of their health conditions and stay home appropriately. Yes, they are finding out that some people will spread asymptomatically for a couple of days previous to that. That's unfortunate, but the best we can do is to make sure that we're staying home when we're ill, practicing good social distancing, using hand wash or hand sanitizer, covering mouths with a cough, although if you had a bad cough, you shouldn't be out. You know, some basic things also like, you know, minimizing the amount of times you go out to the grocery store to get stuff. You know, once a week is better than once a day. And, you know, a couple things we did this week is we did close the beach parking lots. The beaches themselves are not closed if you can access them without the parking lots, but we had a problem. And we're going to continue to have problems on those nice days on the weekends. And, you know, beaches have been really, really full. And so we had to make a decision. And you know, half the town's probably upset about it. The other half of the town might be okay with it. We're doing the best we can. So we have closed the beach parking lots, and we are looking at other areas to be closed. Playgrounds are closed. Something we did this week was any self-serve food service, so the coffee that's being grabbed at a local convenience store or salad bars, they should not be open. And as we get complaints, we'll follow up. We've been getting a lot of complaints from businesses being open that shouldn't be, and we take care of them one at a time and try to get back to everybody as best we can. So to recap it, Falmouth does have more than their fair share of cases right now. We hope that social distancing flattens that out. Some of these cases are already out of isolation, so the number that you see doesn't mean everybody's still in isolation. You know, probably roughly about 20% of those are probably out of isolation by now. So, you know, we'll look at how we report and maybe, you know, put that in. I don't know if we're going to do that at this point. But right now, just know that we have our fair share of cases. We need to keep really diligent about social distancing. So right now, we follow the governor's closure list. If things change, we would obviously adapt to that. And if the governor put a more stringent thing on particular businesses, we would obviously be enforcing that as well. So, again, keep with the social distancing. Hopefully we can see the light at the end of the tunnel soon. And that's it. Thank you.